have the privilege of serving almost 1 million patients in their home annually. For us, we take great pride in that and ensuring that we provide a best-in-class experience for them that's really curated, ensuring that we're deploying solutions that resonate with payers.
What do you think that the best operators consistently get right that others might miss?
We're at a really exciting time in our industry. We're seeing this tremendous evolution of where HME and DME kind of been viewed as those that deliver supplies. And now we're seeing that HME and DME and those that operate in this industry are being perceived as vital clinical partners in the healthcare ecosystem.
When DME providers think about growth, where do you see the biggest opportunity right now?
There's a lot of opportunities to lean into growth. I think one is diversification of the kind of payer mix that a DME or HME is willing to support.
If you could give DME owners one mindset shift for 2026, what would it be?
My advice would be, and what I would want to hear if I was an owner or operator would be just don't feel like you have to boil the ocean. Really lean in to what you do well and do it better than anyone else.
Okay, we are live on the #1 DME podcast in the country, claim to fame. Today we have a very special guest, Yelena Brusilovsky from Cardinal Health. Welcome to the show today.
Thanks, Alex and Wayne. Appreciate it. Really excited to be here.
Yep, welcome. And Alex didn't butcher your name. He got it on the first try. So
it was honestly perfect.
It was at the last second. I was thinking about if I was going to say B or Brusilovsky, and I just went with it.
Yeah, Yelena B. Brusilovsky, but it was perfect.
Awesome. That's a very exciting way to start off the show. Yeah. So usually when we start off is we kind of give you a chance to give the floor to you. If you could tell our listeners a little bit more about who you are and Cardinal, that would be a great way to start off.
Sure, thanks. I appreciate it. Again, so excited to be here. My name's Yelena, or Yelena B. I'm the National Vice President of Commercial Sales for Edgepark, an Advanced Diabetes Supply Group, or ADSG. I have been with Cardinal Health for the last 14 years. I really started my career, the majority of my professional career has actually been in healthcare. I started with a company that some in the industry might remember by the name of Covidien. Covidien acquired Cardinal Healthcare and became Covidien. So I started as a sales rep in Georgia, covering a territory, carrying a bag, selling incontinence products, wound care, enteral, traditional DME products. I was selling those and representing the Covidien products back in 2013, and again, carrying a bag. And that's how I started my healthcare career. A couple years later, Medtronic acquired Covidien, and I was part of the Medtronic family. Again, always focused on the home care alternate site, long-term care market. And then in 2017, I joined Cardinal Health when Medtronic sold the patient recovery division I was a part of to Cardinal Health. So, and then again, fast forward, have been with the Edgepark and EDSG businesses, which are part of Cardinal Health at-home solutions, for about the last 4 years. And here at Edgepark and EDSG as our VP of Commercial Sales, I have the privilege of leading 3 of our selling teams. I lead our urology and ostomy HCP focus team, our market access team that's responsible for managing the relationships between Edgepark and EDSG and all of our payer partners, and then our Medicare Advantage broker sales team. They focus on calling on Medicare Advantage brokers and agents to win referrals for diabetes management products. And then finally, I have our commercial function of payer contracting and sales operations. So really, again, it's been a huge privilege throughout my career to be in the home care sector, long-term care sector, right? It's really the heart of where I feel like patients want to receive care, right, and age in place. And so, again, the majority of my professional career has been in this sector. It's been really exciting to see it change and evolve over the past, call it 14, 15 years. And again, a huge privilege to continue to be in this space and work alongside amazing companies like Edgepark, ADSG, and other innovators and disruptors in this space to really optimize how patients receive care in the home.
Amazing. I have a question that comes to mind. Awesome intro.
Thank you.
What would you say has changed the most about how these healthcare organizations operate or even buy today from a sales perspective compared to, let's say, 14 years ago when you first got into this?
Yeah, it's a great question. I mean, we really seen from a payer perspective, the evolution of payers wanting to work with more strategic DME and HME companies, right? Really trying to evolve past traditional fee-for-service contracting to value-based care, looking at capitated arrangements, and just other innovative ways to manage patients receiving care in the home. And it's been really exciting to see the role that a sales professional plays in this journey, right? I mean, at the end of the day, when you're in a sales role, you are the brand of the company you represent, right? And that comes with a tremendous privilege and responsibility. And so it's been, again, exciting to see how individuals within the sales kind of industry have broadened their market acumen and have become true consultants to the customers they're servicing, right? Whether it's a health system, an HME or DME that they may be providing distribution services for, a healthcare provider or a payer, right? Really ensuring that we are consultants, that we're partners to help them achieve their goals and align our solutions and the value that we bring when, again, what their goals and priorities are. So again, it's been exciting over the past 14, 15 years to see that evolution of kind of maybe a more transactional model to really being those consultants and partners to our end users and customers.
I think that kind of leads me to my next question. You kind of work closely with HME, DME providers, hospitals, post-acute care. What do you think that the best operators consistently get right that others might miss?
Yeah, I think from an HME, DME perspective, we're at a really exciting time in our industry, right? We're seeing this tremendous evolution of where HME, DME historically can potentially have been viewed as those that deliver supplies, right? And now we're seeing that HME and DME and those that operate in this industry are being perceived as vital clinical partners, right, in the healthcare ecosystem. So to answer your question, what I think HME and DMEs are doing well in this space, it's those that are really embracing that evolution, right? And moving from just being part of a recovery site, the home, right, to actually evolving to becoming a pivotal setting, right, for complex care. As we see the convergence of smart technology, right, and a patient population that wants to age in place, right, and then all of this is compounded by the rise of chronic conditions, we are seeing HME providers really lean in to being that essential link, right, that allows the high level kind of acute-based services to be provisioned safely in a person's living room, right, at a fraction of the cost that you would typically see for a hospital stay. And so, and there's a lot of supporting data, right? We're seeing a lot of kind of industry metrics or trends, right? The kind of peak 65 surge, right? On average, about 11,200. You'll have to, fact check me there. But it's about 11,200 Americans turn 65 plus every day, right? And this historic wave will continue. And these are individuals who largely say that about 90% of them say that they want to age in place, right, rather than an institutional setting. And then on top of that, the hospital at home models show that acute care delivered in the home costs on average of 30 to 50% less than inpatient care, right? So you have some of these industry trends going on. And then that's all compounded by the fact that chronic condition management in that 65 plus patient population continues to rise, right? The prevalence continues to grow. And managing these complex ongoing conditions requires continuous monitoring, right? Personalized support and really accessible care. So, I mean, again, to kind of bring it back to your initial question, Alex, of what are we seeing operators, owners in this space do? They're leaning in to home care being that connected hub of care, right? They're leaning into this evolution where the kind of traditional episodic model of care that occurs in a facility simply isn't sufficient, right? And so again, they're leading into the evolution where home care is becoming this connected hub of care and of innovation and an integrated environment that allows patients to really manage their conditions proactively and improve their quality of life.
Yelena, when
more than you bargained for. I know it's a very long-winded answer.
that was
No, this is like a top 3 response.
Yeah, that was top tier right there for sure.
Perfect. The next one will be a top 1 response. We're gonna top 3 to
we're getting there.
We'll get some sound clips from that. That's really good.
This sounds kind of like a TED Talk now. I like it. We've kind of shifted gears.
I love that.
You're
You
crushing.
can just take it from here. We don't need to ask you any more questions.
I will say though, from a soundbite perspective, for HME companies, DME companies that are listening to this podcast or in this industry, I mean, it's just an incredible time to be in this space, right? We are all, whether an HME, DME company, a technology platform solution provider, right, manufacturer, we're all helping people stay where they want to be, which is at home, right? All the while saving the healthcare ecosystem about 30% in costs, right? And that's just, it's truly a powerful story. So it's a great privilege to be part of this journey.
Yeah, and you mentioned the growth. So when DME providers think about growth, where do you see the biggest opportunity right now? Is it product mix, partnerships, execution, all three? What's your perspective on that?
Yeah, I think there's a lot of opportunities to lean into growth. I think one is diversification of that kind of payer mix that a DME or HME is willing to support, right? We have some in the industry that are very heavily focused on government payers like traditional Medicare, Medicare Advantage, or Medicaid, and others that are more indexed to commercial, and some like an Edgepark and ADSD that have robust access for both commercial and government payers. But I do think we're seeing with the new proposed rule and this Medicare Advantage recalibration that's going on in the industry, we're seeing HME companies really diversify their payer mix, right? And understand how can they contract with commercial payers, government payers? How do they lean into this growth strategy that we're seeing of the rise of special needs plans like D-SNP and C-SNP, right? And so as we're seeing this Medicare Advantage recalibration, right, we're seeing like the big three exit certain markets, counties, and states, which we saw in 2026, which honestly in 2026, for the first time in 2 decades, Medicare Advantage enrollment is actually seeing a slight dip or plateau, right? And that's part of this recalibration of the big three exiting markets. And now we're seeing a rise of C-SNP and D-SNP plans, right? And so I think it's a really great opportunity for growth for HME companies, right? Unlike standard Medicare Advantage plans, these special needs plans are structured specifically for populations that are power users of DME, right? Such as those that are living with chronic conditions and or have dual eligibility for Medicaid. So one of the areas I think that we're seeing the growth is again in where HME companies can lean into growth is diversifying their payer mix, right? And leading into the rise of the special needs plans. Also investing in automation and this evolution of technology that we're seeing, right? It probably wouldn't be a podcast if we didn't mention AI. But obviously, we're seeing AI play a really pivotal role in how DMEs operate in this space today. Kind of in 2025, everyone talked about AI, and I think here in 2026, we're seeing it actually being integrated into intake and billing processes and other kind of levers of the DME ecosystem. So I think that's another kind of powerful driver of growth where we're seeing HMEs lean into the technology.
Yeah, totally agree. There's a lot of execution happening right now, which is super exciting to see without a doubt. So I think the technology is a big area for growth. I don't think that was in my initial question, but I really like that you brought that up.
Yeah, I think recently we saw the CMS, the interoperability and prior authorization final rule took effect in January, right? So very recent, couple weeks ago. And this rule honestly represents a pretty significant shift, right, in our operations in the HME landscape in decades. And really, at its core, this rule is mandating that impacted payers, traditionally Medicare Advantage and Medicaid, that they modernize their systems to support a more transparent and electronic prior authorization process, right? And through this rule, they're requiring standardized APIs for data exchange. And the rule also aims to kind of replace the antiquated era of manual faxes with a streamlined digital workflow. And so I think we're really seeing these types of policies in the industry accelerate the need for adoption of technology, right? And so as I mentioned, where you're seeing AI or technology be integrated into like a DME or HME processes, I mean, that you can see it everywhere from intake to management of like clinical documentation. So we're really seeing, as you think about technology, a couple areas that I would point to. One is in the intake process, right? We're seeing HME companies leverage AI to help automate the intake process, right? And so there's AI that can literally read incoming faxes, right? And then help take the kind of manual entry out of the workflow and automate upload of information from your 50-page faxes. And then I would also say where something that's really cool, at least that I think that's happening from an AI perspective and how it's improving our workflows, is around how AI can take kind of unstructured clinical narratives, right, and find specific medical justification that just transparently sometimes humans can miss, right? So for example, in our space, diabetes, one of our largest product categories, AI can actually pinpoint the specific mention of a patient's recurring level 2 hypoglycemia, right? Or it can pinpoint that a patient is testing their blood glucose 4 times a day. And this can be buried deep within a 50-page fax, right, of a doctor's progress note. So really AI is able to act as that real-time auditor at the point of intake, right? And it helps extract those insights and then marry them with a payer's LCD, right, instantly. So as a result, creates downstream implications in terms of reduction in claims denials and helping patients initiate therapy faster.
Yeah.
And I don't know if you were counting how many times I said AI, but it was probably a record. So,
No,
We
it
broke
does
the
come
record.
up on every show.
game, you want to,
Yes.
yeah.
We broke the rescheduling this meeting record and the AI name drop
Yes,
record.
both records have been far surpassed.
You know
But
what?
it
Well,
is
AI
cool
does
just
come
to
up
see
on
how-
every
how
show,
that
so.
technology, right, is it's helping each in an industry that's largely been fact-based, right? To be able to integrate these solutions, it helps our teams work faster, right? And have to focus less on paperwork and more on supporting patients and clinical outcomes, right? And really bringing value to the members that we have the privilege of servicing. And so it's great to see how far we've come in just a short amount of time.
Yeah, absolutely. You know, I've been talking to DME providers about technology for the better part of a decade now, and you really don't come across many that aren't looking at current state and thinking about future state. You know, even if they're not in the market to immediately rip up everything they're doing, it is definitely top of mind of where are the gaps, what's causing the gaps, how can I fill the gaps. And then a lot of people are saying, hey, let's just look at everything, right? We don't know what we don't know. And that's, you know, it's so obvious now and it's happening every day. You know, if you have new technology, people are more willing to think differently. Just the entire mindset, I would say, in the last maybe 36 months, but more so in the last 2 years, is everyone's having conversations about a lot of the stuff you just mentioned, and you know, going in a direction where there's a lot more interoperability. Also another buzzword, but it's extremely important, and we're seeing providers of all different shapes and size. You know, even mom and pops asking, hey, do you guys have an open API? I want to do X, Y, and Z, where, you know, 4 or 5 years ago, that wasn't even on the top of, like, you know, maybe a local provider. And even the big guys are like, hey, how can I face some of these headwinds head on, but have the tools to still take care of my patients, operate at a high level, and just connect the dots, really. So I think you hit the nail on the head with a lot of that.
Yeah, Wayne and Alex, and do you engage with other HMEs in this industry, right? And do you feel that there really is this desire to adopt this new technology, or do you sense there continues to be maybe a little bit of resistance and like wanting to stay in what feels familiar and safe?
I think we're
Well,
a little bit past resistance, but
okay.
I think the execution and implementation is where people struggle wrapping their or pulling the trigger, wrapping the head around it, however you want to phrase it. But it's really, they understand that there's technology out there today that's possibly better than what they're doing now. The hurdle is, how do we, you know, depending on the scale of the organization, how do we get where we need to go?
Right.
You know, it can feel very daunting, right? Especially if you're saying, you know, I've talked to all different organizations of all sizes saying we want to do a digital transformation. What does that really mean?
Right.
And how do you do it? But I think the eyes are open. There's definitely early adopters, even what we're doing. We have a lot of customers now, but it wasn't always like that. But the conversations are easier. People are more open. They're less stuck in their ways. I think the next step is, how do you make it easy for them to evaluate software, easy to buy, easy to implement, in my opinion. But there's
Yeah,
a
and
lot
if
more openness, and these conversations, you know, we can't keep up with the conversation sometimes.
If you look at like, have you heard the book Crossing the Chasm, where they talk about, where that chasm starts and how people adopt technology? So if you're looking at it from the beginning, it's like a bell curve, and the beginning of the bell curve is like early adopters. And I think we're past that now, right? We're now kind of skipped from that chasm into the next one, which is really like the early majority. So I think that we're crossing early majority and going into late majority, meaning I think there's going to be a lot more adoption. And to your point earlier, which I thought was interesting, was everyone's been talking about AI and all these new technologies in the past year. And I think now, as we go into 2026 or 27, we're going to see how it all shakes out. And I think that's going to be fun and interesting to see what technologies are actually going to stick, which ones are fluff and which ones are real, and how and the best will win, right?
Yeah, and I think too, like over this past maybe year too, because some of these technology solutions have been implemented, I mean, we're hearing real-time feedback about the results that they're driving for the industry, right? With payers, for example, implementing these automated prior authorization workflows, they're seeing a reduction in like 70%, right? In terms of turnaround times for them to review prior authorization requests, right? Because they have to. With this interoperability rule, they have 72 hours for urgent requests and 7 days for standard, right? And just the sheer volume of prior authorization requests they receive, they have to use technology to codify how they evaluate those processes. So it's exciting to see some actual metrics, right, coming out of these solutions and how they're driving results for the industry, because I think that will help accelerate how others want to adopt technology and deploy it within their own businesses.
Yeah, absolutely. And, curious from your perspective with Cardinal, you guys interact with probably almost every DME provider out there, at least in some capacity, depending on which product lines they offer. But what, in your opinion, kind of separates like a vendor relationship from like a true strategic partnership? Is it possibly making recommendations to technology, just being, what kind of separates you guys as a trusted voice with your customers at the end of the day?
Yeah, Cardinal is an interesting business, especially our at-home solutions business, because we actually have two segments. We have our wholesale distribution arm, which is our at-home solutions, and then we have our direct-to-patient insurance billing arm, which is Edgepark and ADSD, which is the business I represent.
Yep.
But speaking first, our wholesale distribution arm, at-home solutions, that side of our business, right, serves as the fulfillment arm for other HME, DMEs in the industry, right, that don't have their own warehouses and distribution footprint. We are their footprint, right? And we ship products on behalf of other DMEs and HMEs directly to a patient's home. And so for that specific business, they're very much focused on, what is our product mix, the manufacturers we partner with, right? We want to make sure that the HME and DME companies that entrust Cardinal Health at-home solutions with their distribution have a robust product portfolio so that they can drive stickiness with their patients and really be a one-stop shop. We also continue to invest in our distribution footprint, right? Mm-hmm. Within our at-home solutions business, our distribution centers are exclusively dedicated to patients receiving products in the home. We don't share distribution centers, for example, with our pharmaceutical distribution business or our acute distribution business. And we continue to invest in our infrastructure and technology solutions that allow us to pick, pack, and ship boxes faster and make it more efficient for our kind of frontline warehouse teams. So, and that's, you may have seen articles around Auto Store, which we've implemented in a couple of warehouses, which is our robotic system. It's pretty cool to have you at one of our warehouses to see it. But it's amazing to just see how, again, it increases kind of the efficiency of our operations. But in terms of being that partner, it's really, again, making sure we have a diverse product mix, that we are delivering on our service level commitments, right? And that technology and automation in our warehouses helps us do that. Another way that we really partner on our wholesale side of the business with HMEs is being that advocate for them, right, in the industry, right, to help champion increased and sustainable reimbursement, to help champion access for the patients that they service. So we work closely with advocacy organizations like AA Home Care, right, to really support the critical work they do to preserve access for patients and help ensure that reimbursement and funding in this industry is sustainable. And then on the Edgepark ADSD side, I mean, the same, right? We have the privilege of serving almost 1 million patients in their home annually, right? And for us, we take great pride in that and ensuring that we provide a best-in-class experience for them that's really curated, right? Ensuring that we're deploying solutions that resonate with payers as they try to reduce total cost of care and improve the member experience and fight for funding from CMS for star ratings and HEDIS scores. So really, I think it's about putting yourself in the position of the customer that you're servicing, right? Or that you're supporting, whether it's another HME, DME, or a payer or a patient, and understanding their pain points, what are their needs, and how can we solve for them in a way that's really intentional, thoughtful, and in an innovative way. So that as they grow, and we win together.
Absolutely. And kind of thinking about the organization you lead now on your side of Cardinal,
Yeah.
what in those experiences that you have, kind of one, I guess, leadership lesson from, managing these large teams from a sales perspective, I guess. And part of it made me think of that of like, putting, you mentioned putting yourself in the shoes of the customer, right? That empathetic kind of aspect. Is there any other kind of lessons that you've learned from a sales perspective and working with these DME companies?
Yeah. What's interesting that I'll say is from a leadership lesson perspective, our HR business partner actually said, this isn't necessarily like working with an HME, DME, but as being a leader and having the privilege of leading others. Our HR business partner sent an article out that somebody had written. And it was basically, they were working for a consulting company, and they were saying how in this consulting company, it's very hierarchical. You have like the consultant and the partner, and this individual was telling a story that he was new to the company, and his boss, his SVP or VP, asked him to complete a certain project or a presentation for a client. And that he was new to the company and was working on it and was kind of burning the midnight oil. And his boss came in and asked, like, what are you doing working on this presentation? And he's like, oh, I wanted to, and basically asking him like why he didn't give it to like the employee reporting into him. And basically, it was a story around how he was like robbing him of this experience to grow and develop. And it really resonated with me because I think it's just an important leadership lesson in terms of providing opportunities for the team that reports into me to give them opportunities to grow and like have influence in the industry and have experiences that otherwise they wouldn't. So for me, in my specific realm, like something that comes to mind is when we have an opportunity to present to a payer, right, and our value prop and how we can work with them differently, just like affording that opportunity to others across the team to have these unique experiences to engage in the industry or, have a seat at the decision-making table, et cetera. So from like a leadership lesson perspective, it was a really powerful article. I'm definitely not doing it justice.
I'm gonna look it up or send it to me.
You'll be like, okay, this really resonated with me.
For sure. No, it's
Great.
interesting. It's always interesting.
I'm sure. I was going to say, Wayne, I feel like you can probably answer that question as well. What's like something that you may have learned in your sales experience? You've been doing this for like a decade in DM. What do you got cooking up?
No just means not right now.
Yeah. Yes. It's funny.
That's a simple one.
Yeah, I always talk about like the assumptive clause. And so whenever I'm asking, if I have to ask my boss for something, I'm always the assumptive clause. I'm like, I'll just assume yes. And if it's and if it's a
not
no,
if, it's when.
I pretend I didn't hear you. So
Or will you give me a discount? Yes, if you sign up today.
yeah.
Yelena, how do you balance the discipline execution with giving high performers room to do their own thing, their own way? Because that's probably an important aspect of what you do on a daily basis to some degree.
Yeah, I think it's really just learning to, and this is like something that I continue to focus on. It's really about learning to trust your team, right? And giving them the room to like fail and fail again and continue to grow and creating a safe space to do that, right? I'm somebody transparently that grew up as an individual contributor for a long time, right? Carrying a bag, responsible for my own kind of paycheck and territory. And so the evolution for me into sales leadership and managing a team and teams of people, it's been an interesting journey. I've had to learn how to let go, trust my team, right? Let them, again, give them the room and the grace to make mistakes and to fail and to succeed and, create that safe environment for them, right? And then also give them opportunities to feel empowered, to just kind of step outside their comfort zone, to find their voice, to feel free to speak up. And I think it just, again, it comes with practice and time. And I've been really fortunate that my leadership team is really great at coaching up or providing feedback up and being transparent with me about how I can help, what I can do to change and grow, evolve and support them. And honestly, the success of our team is really the sum of our parts. And So yeah, I think it's honestly, it's come with time, and it continues to be something that we work on, and yeah.
Amazing. We're getting a little bit closer to the end. We usually always come with some bigger picture thoughts, and then we'll move into our kind of fun rapid fire section that
I love that. Yeah.
we mentioned. What trend in healthcare distribution are people not talking about enough?
Yeah, in healthcare distribution, I think something post-COVID that was really focused on, and I've seen us move a little bit away from, is just that network resiliency, right? That companies like I personally, selfishly would say Cardinal Health offers, right? In ensuring that in the event of some sort of emergency, right, or something that's unpredictable, ensuring that the companies you're partnering with can offer you that stability and resiliency, especially in the industry that we operate in, right? We are taking care of patients, and oftentimes with life-sustaining equipment and supplies, right, who cannot go without a missed shipment. And so partnering with companies that can offer that stability, resiliency, that have invested in their network infrastructure, right, and kind of logistical distribution capabilities, I think is really important. And so I do think, right, during COVID, as we were seeing, disruptions and product back orders, and it became really important. And so there was a lot of dialogue around that resiliency, right, and people building out their networks and supply chain capabilities. And so I think that's an area that I know we continue to focus on, and is a core element of our value proposition. And right, and we have the privilege of being that distribution fulfillment arm for hundreds of DME, HMEs, and that network resilience is important, because at the end of the day, right, they're the brand to their patients, right? They're the ones that are accountable if we don't get a product there on time, or there's a product back order, right? So working with our manufacturers and investing in that kind of resiliency and stability of our network is really important.
Amazing. Yep.
I think I have one final question before we move on to the rapid fire round.
Yeah.
If you could give DME owners one mindset shift for 2026, what would it be?
Wow. Okay. This is a tough one. I think for me, we talked a lot about AI and technology and connected hub of care, right? And just these like big kind of grandiose visions and words. I think for me, like my advice would be, and what I would want to hear if I was an owner or operator, would be just don't feel like you have to boil the ocean. Really lean in to what you do well and do it better than anyone else, right? Maybe smaller mom and pop DME, HME companies, you can feel pressure, right, to want to gain access to an Elements, right, or United Healthcare, and gain share within their entire networks. And honestly, while I understand that pressure, I think that smaller, maybe regional or local HME DMEs, they play such a vital role in the communities that they service, right? And we've all heard these buzzwords of kind of these healthcare deserts, right? And they play such a pivotal role in caring for members in these communities, right, that they operate in, that they've been in, right, where Mrs. Smith knows your name and will walk into your storefront, and you'll always help pick up the right product, or whatever it may be. And I think that human element of what we do just is so important. And so I think, like, again, to kind of bring it back to your original question of the advice, it would just be really lean into what you do well and do it better than anyone else. And don't kind of feel so much pressure to evolve with the industry. I think that's table stakes and it will happen, but I don't know that human element, and kind of the role that we play in helping patients receive care and age in home, I don't think that can be replaced. And so, yeah, I think that would be just don't feel like you have to boil the ocean, and lean into what you do best and what makes you kind of the best of what you're focused on.
Amazing.
Totally agree.
Solid answers. This has been a really, really great episode so far. So let's wrap it up with our rapid fire round. It's kind of like a this or that. So I'll start off and we can get going. Okay, let's do it.
I'm nervous.
These are really, 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 really hard. So
okay.
Yeah, I don't know if you're ready for it.
I'm not.
Planner or wing it?
A planner.
Loud laugh or
vacation.
silent laugh?
You don't want to go on vacation.
You would feel like this is not a vacation.
Yeah. Breakfast, lunch, and dinner plan.
Itinerary.
Yeah.
Yes, long itineraries. Yes. Okay, sorry.
Yeah, sorry. Loud laugh or silent laugh?
Oh, In the middle? Is that like depends?
Medium
What I want.
laugh.
Yeah.
Airport early or just in time?
Oh,
I feel
just
like I
in
know the
time.
answer to this. Oh, okay.
I also
wasn't
have, if
expecting
you're,
that.
for a separate podcast episode, I have several airport pet peeves that I'm happy to tell you about.
Tell us one.
This is a really strange one. And when I tell people about it, they think I'm crazy. When people, and if you do this, I apologize. When people roll their bags behind them, I can't, because you know how most
Instead of
bags that have
pushing it,
four
yeah.
wheels?
Yeah, you can do it on the side on the four wheels. Yeah.
Yes. I hate when people do that because they take up so much space, and I'm always arriving to the airport last minute, and they're just
So you're kicking their bags as they're behind them.
yeah.
Yeah.
That's probably. Do you guys have a travel pet peeve? I know
That
you're
is
on the
a good
road a
one.
lot.
You know, this one sounds kind of like a first world problem, but it's if an Uber has cloth seats, not leather. I've been to some cities where you can't get an Uber, and like it's just
That's
so
a good
dirty
one.
to me.
That's an
but, like,
interesting one.
yeah, when it happens, I was telling someone about it, and now every time it happens, I'm like, this is awful. Like, how many people have sat in this seat?
It's smelly.
Yeah,
It smells like problem number one.
yeah, that's one of mine.
I have a very big one, but it's also very first world champagne problems. When you go to the airport and the lounge is nowhere near where your gate is, so you have to figure out and plan accordingly. How am I getting from the lounge all the way to my gate in some
See, when
reasonable amount of
you're-
time?
I've become just in time now that I just go to the gate.
Yeah.
I don't even go. I'm there as little as possible.
Are you
That's
at
good.
Sky Club? Are you Delta, Alex? Or
No, I do like American Express, like the
Got it.
Centurion Lounge or whatever lounge they have.
yeah. No, the travel pet
Yelena-
peeves are interesting. One of my coworkers told me one. I didn't know that this was a rule, but did you know that when you're deplaning, apparently the left row is supposed to go first?
Really?
Well,
I
I
didn't
don't
know that.
Anyways, it's
No one
there's-
knows that.
There's a question on there.
Clearly.
Me and Alex have a list of the rapid fire questions. One of them is what's your favorite city to travel to for work? I think that's appropriate.
relevant. Yeah.
Oh, that's a good. Wait, are you asking me or you're? Just
Yeah,
saying-
yeah. What's your
Oh,
favorite
okay.
city to travel to for work?
My favorite city, probably. So I'm in Columbus a lot. That's where our corporate office is. It probably isn't my favorite city, but Ohio is home for me. Probably Chicago or New York, if I had to pick between the two.
Awesome.
Nice.
It's
but
fun to
not
be
the-
in a big city.
But not the New York airports because those are
No, or getting from the airport into the city, also.
correct. Yeah, also
JFK,
terrible.
JFK to Manhattan is fun.
It's
Yeah.
special. Same thing with LaGuardia. Very
Yeah.
special.
I have a rapid fire question for you both. This is
This is
Okay.
the first. We've
This
never
is fun.
gotten
I like
one.
this.
I see
Yeah.
I'm flipping the script on you. Cats or dogs?
Ooh. Dogs.
Wayne.
I have a golden
I,
retriever.
It's funny because I grew up having a cat when I was a kid, and I never had a dog. But now I'm allergic to both somehow. So I don't think either
There's
right now.
medicine. You can just take some allergy medicine.
I feel like I don't want to do
There is.
that.
I'm allergic to my dog, and I love her to death. But yeah,
That's awesome. Okay, group chat MVP or observer?
Probably an observer, but also I'm one of those texters. You know how some people text in a paragraph?
Yes.
And then
You're like a
other,
line-
so I'm the other, where I just text my thoughts as they happen.
yeah, I do that
Oh,
too.
no.
Like a
So
voice
it's
to
like
text?
12 texts is how I, yeah. So,
No,
Got it.
Alex
Okay.
can probably know. Like, I'll send him a text of like 3 separate lines after.
yeah.
Half
Well,
of it-
it's also not English, and I had to try to like figure out and translate like the Wayanese of whatever was said.
Yes. No, I'm the same way. I just write 12 messages in a row.
Yeah. Okay, last one. What's your guilty pleasure TV show?
Oh, I just did this with my market access team. We brought on a new team member. We did that. So it changes. I'd say recently The Sopranos.
Really?
Yeah.
I love
so I'm
that.
someone that loves
Yeah.
I like to work at night to get caught up, and I always have it on in the background. And I
I
probably
need
have
to
a lot
watch that
of
again. I
That's
love
a good
that.
one for
probably
sure.
so-
That's actually the best answer I think of today. I'm very happy you said that. So really, really pleased with
What
your
about you
performance.
guys?
Oh boy. I mean,
No,
guilty. pleasure.
mine used to be like just go to bed, put on was The Office. I haven't binged it in
so
a long
good.
time, but
Office
I was
is great.
I
Eastbound
would
and
still
Down,
say it's
great.
top show. But I watched it so many years just to fall asleep to bed. I've taken a break, but that was my number one, just like guilty pleasure, brain
That
drain
was
show.
great. Have you seen
Yeah.
the British version?
I've seen some of it, but I haven't gotten too deep into it.
It's not too
Yeah,
good.
it's
Is it as good?
Yeah.
It can't be as good, is it?
No,
Can't be good
it's
to me, no.
different.
Yeah,
it's
it's
much
different.
more It's less PC for sure.
I love that. Well,
Yeah.
Yelena, thanks so much for joining today. This has been a lot of fun, and I love how you flipped the script on us. So that was obviously a great time. If anyone wants to reach out to you or find out more information about Cardinal or get in contact, what's the best way for someone to do that?
Yeah, anyone can reach out via my email. It's Yelena.Brusilovsky. So if you can figure out how to spell Brusilovsky, you can get my email. But it's my first stop, my last name at cardinalhealth.com. And I really
Perfect.
appreciate the opportunity. Really enjoyed today's conversation.
Yep,
Awesome.
likewise. And looking forward to seeing the team out in Phoenix for MedTrade.
Absolutely.
This will air after it, but yeah, we'll talk about it after.
Yeah. Looking forward
Thanks so
to it.
much.
Thanks again
Yep.
for the time and the opportunity.
Thank you. Have a good one.
Thanks.